Ramsey County Community Human Services has created a short video series aimed at sharing the story of its proactive work to become an anti-racist, multicultural organization. These videos have been developed to share the accomplishments and lessons learned over the past 10 years. These videos are not an exhaustive representation of our work, but provide a glimpse at some of the highlights, both successes and challenges. The first video shares highlights of the history and emerging framework for CHS's anti-racism change effort. The second video highlights the formation and operation of the anti-racism leadership team. The third video highlights bringing about staff change through a system-wide staff training program, leadership development, and systematic communication on anti-racism. And the fourth video highlights bringing about change in services through the example of Creando Puentes. Here now is video 4, highlights from bringing about change in services through the example of Creando Puentes. Thank you for joining us.
Creando Puentes means building bridges. This program is a collaborative effort between La Clinica, CLUES, and Ramsey County Community Human Services. It is designed to provide outreach to the Latino community in Ramsey County. Our bilingual, bicultural case managers are working to improve access to mental health services. The goals of the program are: provide support and information for individuals affected by mental illness, encourage an understanding of mental illness within the Latino population, provide access to community resources and services. My name is Kirk Fowler, Manager of Adult Mental Health with Ramsey County. The last number of years in Ramsey County Human Services, we've been addressing the disparities in delivery of services to the community. We have identified in our Adult Mental Health Unit a significant disparity in how we provide services in the Latin American Hispanic community. Out of this work, the Creando Puentes project was created. The result of this project was that the disparities have decreased. We are reaching more people in the Latin American Hispanic community. This is one of our major successes. Another crucial result is that we learned as we went along with the project is that we had to identify initial challenges and barriers that we didn't anticipate. With this, we had to change the program and not deliver it as in the old ways in the past. Our goal was to provide comprehensive and far-reaching services, and we had to remain flexible. In this presentation, you'll hear from the case managers and the supervisors about the strengths and the challenges of the program. This covers a far-wide continuum of services, from addressing issues of direct service to also recognizing the role that institutional racism plays in the work that we do. For this project even to have a chance of being successful, it was important that we identified the necessary ingredients for the success. We first started off with the community and identified the key partners in the community to talk to them about what program was necessary for case management. The feedback we got was loud and clear. First of all, be located in the community, be advocates for clients thinking outside the box, and also be advocates for system change. And last, and probably just as important, don't leave when the funding becomes tighter, as it has become. Out of this, our ongoing concern was to build the relationships with the partners for those who are anchored in the community. It was all about building trust with these partners and establishing credibility and trust with the clients as well. Building trust was the key. It was also important to provide leadership to this issue from Ramsey County, and also to partner with those leaders in the community as well. Without this, it wouldn't have been possible. Last, it was important to measure our outcomes, whether they were successful or not. And just as important, to get back to the community the results of the program and with these outcomes. Now that you've heard about our program, its development, and the results of the program, I'd like to turn it over to our panelists who represent the supervisors and the case managers. They'll talk about the direct services as well as some of the lessons learned throughout the program.
Creando Puentes is a program that is a partnership between CLUES, La Clinica, and Ramsey County Human Services. As a supervisor, have you encountered any unique barriers or challenges while supervising a project that is a collaboration of different agencies?
When we started Creando Puentes, we really believed that we would be doing short-term services, providing outreach in the community, and then connecting folks to county services via a warm handoff. And while this has worked much of the time, some of the time it hasn't worked, and that's for a couple of reasons. One reason is that we do great services in Creando Puentes, and the other reason is that the way the county delivers services doesn't always fit.
We knew that we were going to provide services for an underserved population. And we knew very early on at the program level that we needed to think outside the box. We needed to be really flexible. We needed to take risks in programming for the Latino population.
We have bicultural, bilingual staff. Our staff is able to reach out to people in a really flexible way. And that's really important because of the stigma of mental illness in the Latino community. Folks don't always define their problems as mental illness. And so we can connect with people based on how they define their problems or their issues. And I think that's really an important point. So they're comfortable, they're working with bicultural, bilingual staff in the community, and we're helping them with their defined problems.
And I think we found that some of the risks worked very well, others didn't. We didn't hesitate that if it didn't work, to go back to the drawing board and think about it differently.
We've had a lot of conversation about how we want to deliver the services and gone back and forth a lot about, do we want to do the delivery in a traditional way or do we want to change it to fit the community? And that's what we've really done. We've changed the delivery of our services to fit the community and the needs of the community, the population that we're serving.
People are uncomfortable also coming to the county for services. There's some history there that makes them not comfortable receiving services at the county. So I think what we've learned is if we want folks to access our services at the county, we also have to change the way we're delivering services. We need more bicultural, bilingual staff. We need to be more flexible in the definition of who we're serving and how we're serving them. And we need to be in the community. We need to go to folks where they are as opposed to having folks come to us.
And as a result, that's also changed the way we've had to build relationships. So with the population that we serve, we've had to go out into the community and we've had to build those relationships with service providers, but also with places such as churches and clinics and the places that the community goes to.
Creando Puentes provides culturally competent case management services to the Latino community, and you are both bicultural, bilingual case managers. So what does that look like in the work that you do? What does culturally competent case management look like? Could you just give us a couple of examples of either successes or barriers that you found in your work?
One of the barriers that a lot of our clients have is they're underserved or maybe they don't have insurance.
As a Latino person, I realize that the Hispanic community have many barriers to overcome. It's not the inability to communicate in English, but also the lack of education, therefore the lack of knowledge, in addition to the barrier of fear. I know people that have suffered from injustice, racism, exploitation. So I think people is scared or is afraid of standing of their rights, for their rights.
The way we do our location is really important. We're located right within the community, and that makes it more accessible to our clients and less threatening.
So it's when my work turns me from being a person passive, more like observer person, to be an active, hands-on worker. So I become as an advocate. I speak on behalf of my clients. Sometimes I have to push hard or even harder to help them to get the resources that they need or the benefits that they are entitled to.
Our flexibility is also different. We're able to meet the clients at home, in the community, or even at a coffee shop, and that helps a lot to be able to continue with case management with our clients.
So I really believe that being culturally competent doesn't mean being fluent in Spanish, but understanding the context of where we come from as a Latino and minority community.
From this, I think you've heard that we've learned a great deal from this project, and I think it's safe to say that we have a lot more to learn. Flexibility is the key as we attempt to knock down a number of the barriers that we've identified in the way we do our work. By maintaining the contacts with the community, building relationships with our partners, and establishing credibility with the clients, we hope to improve the services and reach more clients as we go along. Again, the trust and credibility is the key, one that we recognize and that we learned from in this project. Thanks for taking the time for listening.